This is Dr. Charles from NexGenEsis Healthcare. This is phase 2 of low back stabilization. Now, during phase 1, I mentioned to you that if the pelvic tilt exercise where you tighten the abs, tilt the pelvis, and flatten that low back into the table, it may be too easy for some of you. You won't feel the challenge, you won't feel the burn in your abdominals. So this right here is a great exercise where you can make it as hard as you want. It's one of my favorite abdominal exercises. So this one, you're in this position. Now see, I automatically do it out of habit, but what you want to do is, the way you want to set your low back and your pelvis is put it in that posterior tilt position where you tilt the pelvis out and have the table kind of hold your tailbone down. You'll notice when you lay down like this, it is so comfortable for the low back, right? For those of you who like to sleep on your back, this is also how your pelvis should be positioned. Your bed should be holding the tailbone down, and that should feel very comfortable for the low back. Now this is the starting position where no low back is nice and neutral. There is no stress on that. Now, from here, what you wanna do is put your hands straight up like this. Now, what you wanna do is, using your abdominals, you want to take the chest, the torso, the head, straight up that way as much as you can. So the way this is different from, for example, a sit-up, right? As the weight transfers forward let me show you to exaggerate it. See, when I come here, you see all the weight is on my low back. I mentioned avoid compression, avoid weight-bearing exercises of the low back at this point. So instead, what you would want to do is take the chest and try to go straight up that way. And that way the low back stays nice and neutral. There's no weight. And I feel it right here. It is more difficult for the abdominals to try to pull the torso up straight up this way. Some of the things we talked about, slow on the way down. This is engaged the whole time. I never let this rest. I go up, slow on the way down, and before I have a chance to rest, I'm going back up, slow on the way down. Now, you can make this as hard as you want, because if you carry something, a weight here, what you're essentially doing is using your abdominal strength. You're pushing this weight up into the air. And once you feel confident in your abdominal strength, we can begin incorporating the lower abdominals, which is going to be a part of phase 3. Now, here is an additional muscle group that I would like to add on for phase 2. Is what we call the lumbar erector spinae. That's the 2 big pillars right alongside your spine that run up and down like this. Now, something like deadlifts, people say bad things about deadlifts, and if it's done incorrectly, it can be detrimental to the low back. I agree with that. The biggest mistake that people make when doing deadlifts, your low back is like this in a neutral position. You see there's a slight curvature right here. Now, as you do a deadlift, and when I say a deadlift, it's this motion where you're kind of picking something up, right? This is a deadlift right here. Your low back should never do one of these. Your low back should not be the one bending forward and backwards. That's the same thing when it comes to picking something up. Even something as simple as washing your face over a sink. You see my low back is curved this way, right? Instead, what should be happening is your low back, as your torso goes forward, your low back is this. Your low back does not even move, right? And it's because all the motion happens at the hip joint, not at the low back. An easy way to test this is put these bony things in the front right here of your pelvis, put your fingers right on that, okay? Now, as you bend forward, the movement should happen below your fingers, right? So this bone right here is your pelvis. The movement is supposed to happen at the hip joint, not at the low back. So if this is done incorrectly, you will feel there's no movement happening below the fingers. Versus if it's done correctly, all the movement happens below the fingers. You see, my low back does not even move when I do this exercise. My low back stays nice and neutral. So the pelvis and the low back, it is one. It is locked in, it does not move, and it's the pelvis that's tilting forward this way and not the low back doing this. So this is pretty simple. You can use anything. I mean, we can use a chair, just any type of weight. Well, I do recommend you practice that movement first, this forward motion where it happens at the hips, not at the low back. My low back, just put your hand right on your low back and do this. My low back does not move. It is all at the hips. And this is exactly what the exercise is going to be. Knees slightly bent. You're gonna hold it right here in front of you, whatever the weight is, right? Now, it is important that your low back does not bend, and I'm here. Slow on the way down, knees are slightly bent, just down and up. You see my arms don't even move. All the motion happens at the hip joint. So what you will feel as you do this, so you notice how I'm going slow on the way up, and I'm not going all the way up because I don't want it to rest, right? You're going down, and where you should feel this is exactly those two pillars that I talked to you earlier about that run alongside the spine. So that's the muscle that we want to strengthen. Please keep the weight low, and this is only after you feel like you're very good at the motion, where you can tell, hey, my low back does not take any stress when I do this because all the movement is happening at the hip joint, right? This one's a little bit different in a way. I have all my patients, well, most of my patients, fight through the burn and take the muscle to fatigue, meaning go until you can. This is not one of those exercises. You want to make sure that you still have a few left in your tank when you stop, because we do not want these muscles to fatigue out and go to exhaustion and failure, because then your low back will have to take the stress, and we do not want that at this point. So keep this going right here. You should be feeling it right in the pillars right there, and that is phase 2.